corona pandemic has been expanding to 198 countries all over the world. Though in our country it is in stage 2 level only, there is every chance of entering into the stage 3 in the forthcoming 2 or 3 weeks. So it is the responsibility of the every citizen to follow the Prime Minister's call of lockdown, and nobody should move from the respective places, and we have to obey the orders given by the central and state governments respectively. In spite of all these orders and all these laws, many of the students are crossing the borders, interstates, and violating the laws. So we have to understand and cooperate. The main intention of taking down this call of lockdown is we have to prevent the community transmission, because 80% of the corona is transmitted through the droplets and the fomites, and 20% is only the airborne. So we request all the doctors and the paramedical person, the police, the media, and all the sanitation workers who are in this job, they have to take care of themselves, they have to take care of their lives, and they have to protect the families and the families of the patients too. In this regard, I request the central government and the state government to take care of the healthcare professionals by providing the personal protective equipment liberally and all the N95 masks to all the people who are working in the isolation wards and quarantines, because in future the number of the suspect cases and the number of confirmed cases may be increased very rapidly, so that at that time it will be difficult for us to procure the PPEs. Already all the private hospitals are unable to procure PPE, sanitizers, N95 masks, and we are not able to get it. So we request that there should not be any discrimination between the public and the private healthcare system to provide the PPE, and we can take the help of the big industries, the textile industries, and all the self-help groups to start stitching the N95 masks and to prepare the PPEs at the very reasonable price, so that it should be affordable to all the doctors, particularly the rural doctors who are working in the primary healthcare centers, and all the ASHA workers, ANMs who are going for door-to-door survey, and all the Grama volunteers who are working on the roads 24/7 continuously. So it is the responsibility of the government to procure not only the ventilators, the oxygen connections, the isolation wards, but to take care of the health of all these healthcare professionals by giving all the necessary equipment, and if possible to give the health insurance to all the healthcare professionals, those who are working in the COVID-19 wards by the state government, so that if any unforeseen casualty occurs in the fraternity, we have to take care of the families too.